The Functional Status Score for the Intensive Care Unit, or FSS ICU, is a validated outcome measure used to assess a patient's mobility while in the intensive care unit. It's easy to perform and consists of 5 functional activities that are each rated on a 7-point scale. The 7-point scale measures patient ability to perform activities based on level of assistance required to complete each task. As previously mentioned, the FSS ICU evaluates the patient's ability to perform 5 functional tasks while in the ICU. These tasks include rolling, supine to sit transfers, sitting at the edge of the bed, sit to stand transfers, and walking. As we progress, we'll go through the 7-point scale that's used to assess patient level of assistance required to complete each task. Each task on the FSS ICU is rated on a 7-point scale. The 7-point scale used for all tasks apart from walking is included here. The scores range from 7, which indicates complete independence completing the task, to 0, which indicates that the patient is unable to perform it due to weakness. We'll go into more detail for each number and score for each task in the following slides. A score of 7 indicates that the patient completes the task with complete independence. This means that they're not requiring any physical assistance from the assessor, and they are not requiring any assistive devices to complete the task. In the instance of rolling, the patient is able to roll with the head of bed flat and does not use the bed rail. In cases where the patient has a head of bed elevation order, such as patients on a ventilator, this does not detract from their score for rolling or supine to sit. For a 7 on the supine to sit, the patient is able to sit up on their own without use of the bed rail, but are allowed to push up from the surface of the bed to help them. For sit to stand, the patient is able to stand without using their arms to push up from the surface of the bed or their legs, and they experience no loss of balance upon standing. Lastly, for sitting edge of bed, the patient is able to sit without use of their arms on the bed or chair for support and without using bed rails. They also experience no loss of balance while sitting. It should be noted that assistance from the assessor to manage ICU lines or equipment is not considered assistance and does not detract from the patient's score. Patients who complete a task with modified independence on the FSS ICU are given a score of 6. This means that they're completing the task without physical assistance from the assessor, but may need the use of a bed rail or an assistive device to complete the task. For rolling, patients are able to roll on their own without hands-on assistance or cueing from the assessor and will probably need use of the bed rail to help pull themselves over. For supine to sit, the head of bed may be elevated slightly to assist the patient with the task, and they may use the bed rail to help push themselves up. In the instance of sit to stand, the patient is able to stand on their own, but uses their arms to push up from the surface of the bed or the bed rail to stand. They should not experience a loss of balance. This includes patients who need to use a rolling walker for balance upon immediate standing. Lastly, for sitting edge of bed, these patients are able to sit without supervision and without hands-on assist from the assessor, but need to use their arms or hands for support on the surface of the bed or bed rail to keep their balance while upright. A score of 5 on the 7-point scale indicates that the patient is able to complete the task with supervision assistance. This means that they're able to complete the task in its entirety without hands-on assistance from the assessor, but does require verbal cueing to complete the task. The patient is allowed to use an assistive device, and this does not affect their scoring for a score of 5 or patients who require supervision. In the example of rolling, the patient is able to complete the task, but may require cueing to bend their knee or reach across their body to turn onto their side. In the instance of supine to sit, cueing may include telling the patient to push up off the surface of the bed and to swing their legs out of the bed. For sit to stand, you may tell the patient to rock forward or lean forward, and the patient is able to use their hands to push off the bed if they need. And lastly, for sitting edge of bed, the patient is able to sit and may use their arms for balance on the bed, and cueing may include telling the patient to lean forward or shift their weight to the left or right. So again, patients are able to complete the task on their own without hands-on assistance from the assessor, but they do require cueing or supervision to complete the task. The The next three scores indicate that the patient is requiring some sort of hands-on assistance to complete the task. It's important to note that for scores of 4, 3, or 2, that the patient is able to complete the task fully, but is graded on the amount and percentage of assistance that they require. So for patients who require minimal assistance, they're performing at least 75% of the task on their own, with the assessor helping them for a small portion. For a 3, or moderate assistance, the patient performs between 26 and 74% of the task, with the assessor helping with the remaining percentage of the task. And for a 2, or maximal assistance, the patient is only able to perform 25% or less of the task, with the assessor helping with the majority of completion of the task. We'll go into these in more detail, and there's also a video to help break down each score for better clarification. In minimal assistance, the patient is performing at least 75% of the task. This means that the patient cannot complete the task without external assistance from the assessor, but is not needing very much help to complete the task. This includes any hands-on assistance for steadying or safety, or what would also be called contact guard assistance. Patients requiring moderate assistance to complete a task are able to perform between 26 to 74% of the task on their own, with the assessor providing assistance for the remaining percentage. Again, the patient is able to complete the task, but they do need external assistance from the assessor. In the case of moderate assistance, they require more help than they would for min-assist, but less help than the significant amount needed for maximal assistance. This will be explained in more detail in a slide or two. Patients requiring maximal assistance to complete a task are given a score of 2. This indicates that the patient is able to actively participate in completion of the task, but are only able to assist with 25% or less of completion of the task. So again, the patient is performing the task to its full extent, but is requiring a significant amount of assistance from the assessor. Now I'm going to go over a series of 3 videos that will help you distinguish between minimal, moderate, and maximal assistance levels. This can be a confusing concept for non-clinical assessors. Minimal assistance indicates that the patient is able to perform at least 75% of the task. This means that the assessor is only providing a little bit of hands-on assistance, as you'll see in this video. This can include steadying for balance and just a little bit of a handhold assist to get up into sitting or standing. Now we're going to look at maximal assistance. It's often easier to identify a patient who requires moderate assistance by ruling out either minimal or maximal assistance required to assist. So for maximal assistance, the patient is only able to perform about 25% of the task on their own, so the assessor is doing the majority of the work to help them complete the task, but the patient is actively participating and able to assist a little bit with the task. Lastly, we're going to look at moderate assistance. For patients who require more than just a little bit of help, as with minimal assist, but don't require maximal assistance to complete a task, they would fall in the moderate assistance range, which indicates that the patient is performing 26 to 74% of the task on their own, with the assessor helping with the remaining percentage. Patients are given a score of 1 when they are dependent to complete a task. This means that the task is performed in its entirety, but the patient is unable to assist in any manner due to weakness. So for rolling, this includes the assessor rolling the patient by assisting them at the shoulder and hip or pulling on the sheet to dependently turn them onto their side. In the case of supine to sit, this would be the assessor physically sitting the patient into an upright position, but again, the patient is unable to assist in the task. For sit to stand, this may include the assessor blocking the patient's knees and independently pulling them up by the hips to get them into a weight-bearing position with their feet on the floor, but again, the patient is not able to assist. And the same goes for sitting edge of bed, where the assessor would be providing 100% of the support for the patient to maintain an upright position while sitting on the edge of the bed. If a patient is unable to perform a task due to weakness, they are given a score of 0. So for example, if the patient requires maximal or dependent assistance to get into sitting, feasibly standing or walking the patient may not be possible due to weakness. The patient would then be given a score of 0 for these unperformed tasks. In the instance where the patient is able to complete a task but requires assistance from 2 persons or the use of a lift device, they are also given a score of 0 for that task. Next, we're going to look at the 7-point scale used for the walking task. Note that the walking scale also incorporates wheelchair mobility if your patient uses a wheelchair at baseline for functional mobility. When using the walking scale, scores are based on the longest distance walked without a seated rest break. Next, we'll get into what each score reflects based on patient distance. This is a closer look at the 7-point scale used for walking. As you can see, for scores 7 through 3, the patient is required to walk a minimum of 150 feet. If the patient is able to walk that distance, the score is then broken down based on level of physical assistance required to assist the patient to walk this distance. For scores 2 and 1, the patient is not able to walk 150 feet, but is able to walk in some form or manner. And again, a score of 0 is given if the patient's unable to complete the task due to weakness. A score of 7 on the walking scale indicates that the patient is able to walk at least 150 feet or greater with complete independence. This again means that the patient does not require physical assistance from the assessor and does not require an assistive device to complete the task. Management of an IV pole or medical equipment by the assessor is not considered assistance and should not detract from the patient's score. Patients given a score of 6 on the walking scale are again able to walk at least 150 feet and are performing the task with modified independence. This means that they're not requiring hands-on physical assistance from the assessor, and they do not require verbal cueing to complete the task, but may require the use of an assistive device or a prosthetic device to complete the task. Patients are given a score of 5 on the 7-point walking scale if they're able to walk at least 150 feet with supervision assistance. This again means that they require cueing to complete the task, but no hands-on physical assistance. In this instance, the patient may use an assistive device for balance in order to complete the task. A score of 4 is given to patients who, again, are able to walk at least 150 feet, but these patients require minimal assistance to complete the task. This means that the patient is performing at least 75% of the work of walking, but does require the remaining level of assistance from the assessor to complete the task. This also includes patients who require simple hands-on guarding for balance or safety while walking. A score of 3 is the last score on the walking scale that indicates that the patient is able to walk at least 150 feet. Patients who score 3 are considered moderate assistance, and they're performing between 50 to 74% of the work of walking. In this instance, the patient is able to walk, but they require more than the small amount of assistance or hands-on steadying that would be considered minimal assistance. In this instance, a patient may use an assistive device and still be given a score of 3. 2 on the 7-point walking scale is the score where the distance walked changes from 150 feet to greater than or equal to 50 feet. In this instance, the patient is able to walk at least 50 feet with assistance of just one person, but is not able to walk 150 feet or more. The amount of physical assistance required is not considered when scoring. It's all distance-based. So for example, if your patient walks with modified independence using a rolling walker but is only able to walk 110 feet, they would be given a score of 2 simply because they could not make it 150 feet. Patients given a score of 1 on the walking scale are not able to walk more than 50 feet, but are able to walk at least a little bit. They require assistance of 1 assessor or assistance of 2 persons for any distance walking. The amount of physical assistance required is not considered in scoring if only 1 assessor is assisting. However, if the patient requires assistance of 2 people for walking any sort of distance, the patient is given a score of 1 regardless. So for example, if your patient walks 75 feet but with assistance of 2 people, they are given a score of 1. In the case of a patient who is only able to walk 40 feet but with minimal assistance from the assessor, they are also given a score of 1. As with the other scale, the patient is given a score of 0 if they're unable to walk due to weakness. In this instance, walking cannot even be attempted or performed by the patient due to weakness observed in other tasks. Now I just want to go over some general scoring guidelines and nuances to scoring the FSS ICU. So firstly, scoring should be based on only 1 evaluator physically assisting or supervising the patient, except in the case for ambulation, where you can have more than 1 person assisting. Also, assistance from the evaluator for management of medical equipment or devices does not affect scoring. So as previously mentioned in walking, if you need to help the patient with IV pole management or oxygen tank management, that's okay and does not detract from the patient's score. And lastly, scoring is based on what is performed during the assessment and not what the evaluator anticipates the patient can perform. So in many cases, a patient may refuse a task or just not have time to complete something. The assessor cannot include what they have seen the patient do in the past or what they think the patient could do based on how they did on other tasks. And we'll go over how to account for missing tasks in a slide or two. Now we're going to go over how to account for uncompleted tasks. So if you're doing an assessment with a patient and they refuse to complete a task or you run out of time, there are still ways to account for that in your scoring and able to generate a total score in some instances. Note that this is different though than if a patient is scoring a 0 on a task. A 0 indicates that the patient is just physically not able to complete the task due to weakness. And this is more for those patients who are refusing or you're just not getting to it. So if less than or equal to 2 tasks are not performed, you can average the other scores from observed tasks and enter that value in the missing lines, but just indicate that the task was not performed. So for example, if your patient rolls with min assist, so that's a 4, performs supine to sit with minimal assist, also a 4, and performs sitting balance with moderate assistance, which is a 3, you could total those 3 scores that you have, so the 4, and the 3, to generate an 11. You then divide that by the number of tasks completed, which is 3, and your average there is a little over 3, but we'll just round it up to 4. So you can enter a 4 in the sit to stand and walking tasks, and then generate a total score. However, if more than 2 tasks were not performed, you simply must leave the missed tasks blank, and you cannot complete a total score for this patient. Because accounting for uncompleted tasks can be a little confusing, I've come up with 2 examples to kind of show you how it works. So in this first example, the patient was able to complete 4 of the tasks, as you can see. They did rolling, supine to sit, sit to stand, and sitting edge of bed, but the patient refused to walk, so this task was not performed, even though they could physically perform the task. So because there were less than or equal to 2 tasks that were not performed, we are able to average the scores of tasks that were performed to generate a total score. So averaging out the rolling, supine to sit, sit to stand, and sitting edge of bed scores, we're given 23 divided by 4, which gives us a 5.75, and we'll just round that right up to 6. So the patient's given a 6 for walking, and then we can create a total score for the FSS ICU on this patient. In the second example, as you can see, the patient refuses to perform 3 of the tasks. So the patient refuses rolling, sit to stand, and walking. And because there were greater than 2 tasks that were not completed, we're not able to average the scores of tasks that were completed, and we're not able to generate a total score. So following this, there's a video that shows an example of a full FSS ICU assessment, and then after that, there's a quiz to assess your knowledge and also practice some scoring yourself. Okay, all right, so we want to do your mobility assessment. So the first thing I want to do is see how well you're rolling. I'm just going to lower your knees here. Because you're on the ventilator, I'm going to leave the head of the bed up a little bit, at least at 30 degrees. But let's go ahead and see how well you can roll on your own. Great, you know, taller on your side. Beautiful. All right, from here, are you able to sit up on the edge of the bed? Okay. You do what you can. If you need help, I'll help you. Oh, great. Okay there. I'm going to lower the head of the bed so you're not... Just check out your sitting balance. Are you able to take your hands off the bed and everything? Looks great. Looks good. All right. Last piece is I'm just going to see how well you can stand up. All right. Sure all your legs are straight here. Okay. Excellent. Good. No help at all. Just a little supervision. All right, so I want you to walk as far as you can without stopping. We'll have a wheelchair to stop when you're ready, though, okay? Doing great. Feeling okay? Still going. Need to stop? Okay. All right, stop right here.
Great job.
Excellent. 130 feet. So let's talk about how the patient did today on the FSS ICU. Okay. She was able to roll, but she did use the rail, but no other assistance, so I would give her a 6 there. When she went to sit on the edge of the bed, she didn't need any equipment, and I only had a small elevation because of her ventilator requirements for head of bed at 30 degrees. So I would give her a 7 there, fully independent. Sit to stand, she did great, but does need a little bit of cueing and use of those armrests and pushing up off of the bed. So that I would think would be a 5. Sitting edge of bed, she was fully independent, no hand support, balance looked great, so I'm going to give her a 7 there. And then walking, she wasn't able to go 150 feet, so automatically she's bumped down, but she was able to do greater than 50 with just assist of one person, so she would get a 2 there. So her total score for the day would be a 27.
Awesome.